This class, we will see about the qualities of forensic nurse and the scope of the forensic nurse. The qualities of the forensic nurse are the same as a nurse, but more high responsibilities because she is dealing with the law and the justice to the society. So she should possess the more better qualities than the ordinary nurse. So the forensic nurse should be non-judgmental because she is dealing with the accused and the victim. She should have a neutral mind, and she always should uphold the ethical principles for her profession. And she must be empathetic. How to be show the empathetic, either the accused or the victim? If they are sick, she has to immediately attend their the need, medical need, either the first aid or they need something or the pain relief. According to the principles, she has to follow and give the first aid. And she should be autonomy to take a justifiable decision and maintain always the professional relationship with the patient. And honesty is a vital important principle in the forensic nursing. If she is dishonesty, though she is punished, she will be giving the bad role model to the society, because of her accused may be released. So the honesty is the best principle, and always she has to maintain the confidentiality all the time related to the cases like RGK or something, some like a very sensitive cases. The important report is not supposed to be revealed to the public unless until the her team members decides, and judiciary committee she has to follow the thing. And then good ethical decision maker. So for to how to take the ethical decision, so she should avoid the ethical dilemmas. For that, she should know what are all the ethical principles, and learning the ethical principles and learning the problems and think twice and the make the correct ethical decision. And she should be a good and active listener and understand the culture and customs and practices of the society where she is living, where she is going to practice. She may be a South Indian, she may be a North Indian, she may be working in a foreign country, in another territory. So she has to understand the culture, customs, norms, and beliefs of the society, and allow the spiritual healer to meet either the accused or the this one. And she has to follow the court order. If there is allowed, she has to follow that. And then impartiality, she never should show the partiality. She should possess the good leadership quality. Who is the leader? The leader is the person who can influence others. So she should be the influential person, and she should have the open minded person and ready to discuss with the team members in loyally. Who is the team members? So the team members of the ordinary nurse are the doctors, nurses, physiotherapists, a pharmacist will be. But here is the forensic team member as a decision maker member, striving to produce the justice to the society. Their team members or forensic nurses team member, mainly the police. Sometimes she collected the information about the accused victim from the police, and the lawyer she has to deal, and the postmortem surgeon she has to deal with the postmortem surgeon. She has to be when the patient alive, she might have taken an interview. The postmortem doctor, she has to tell when alive what is the patient gave, what the kind of a poison taken, and then she can assist how much ml of the stomach or how much she can take the postmortem parts, body parts, whatever the kidney, liver, pancreas, how much they have to take. She can assist with the team members. And also she is liable to answer the social worker, and then forensic scientist, they do the research and other things. She should give the evidence. And forensic psychiatric nurse, also the team member. So why this accused is then why the child become like a delinquency child, why they are like that. So this is the team member she has to, and also she has to possess the good qualities. Next we'll see about what is the scope of forensic nursing. So after BSc nursing program, most of the colleges in the north side in Pune and some of the iconic colleges are opening the MSc nursing courses as a forensic nursing. Once you finish the forensic nursing, you have an opportunity to work with most of the NGOs, and crime branch police department also have an opportunity. Also in the hospital, clinical forensic nurse designation has been given, and there is a special designation is called the sexual assault nurse examiner. And then forensic mortuary nurse, she can assist the surgeon who is working in the mortuary to take up the samples. And then forensic psychiatric nurse, she is going and working in the prison and juvenile home and some of the destitute homes where the children are taking, and can give education to the children. They are not adult, they are in a stage of adolescent to become adult. They might have committed some criminal things, so she can educate them. And also she is correctional facilities available, because some, as I told you, some of the children are doing the mistake, there's a transitional period from the adolescent stage to that. So rather going to the prison, some like juvenile centers will be there, or sometimes there's special prison or special jail they are putting, or prison itself she can give work as to educate them. And then law enforcement agencies, some of the law enforcement, because she is going to study in detail about the laws, what is Indian constitution, what is there, how many pages are there, how long Indian, when it is come to the enactment, what is called democracy, what is called secularism, everything, how the law is being processed. She should have a wide knowledge than the nursing faculty. So that I will take you next class, like what is laws, what she is going to study, what depth of knowledge about laws we can see. So this class, I hope clearly you have understood about what is called the qualities of the forensic nursing and this one. So scope of forensic nursing. Now by the qualities, understand the scope. Next we will see what are all the roles. As the roles you might have understand, because with the team members whom she is working, what are all the roles she may be playing. With that, let us see clearly what are all the roles and responsibilities while possessing the qualities and the areas of the future functioning. First important roles and responsibility of forensic nursing is a history collection, as like other nurse, but the history collection little bit different. As I told you, she collected from the police station, emergency department, and neighbor and witness people, many things. The next important roles and responsibilities of first aid giving, either the accused or victim, and then medical examination, honest medical examination following the protocols. So what is the reference number, clearly writing about the specimen, what she is collecting, the date, time, name of the disease, nature of the material, when it has taken, and better she should know that it can be recorded. Every proceedings are related to the justice, she has to better, video recording will be better. And then forensic photography with video recording and dying declaration. Some patients are dying, death declaration is an important, this one, no one will tell lie during the time of death, so that has to be also recorded. And then provide the comprehensive care. What's called comprehensive care? Sometimes physical care as well as also mental trauma also will be there. So they may be actors is so violent, so you cannot beat back this one, and you have to provide a comprehensive care. Either the spiritual assistance you need, or the psychiatric you need, or the surgical you need, you have to assistant call the doctors, or simple first aid it is needed, you have to give. If it is everything you have to arrange it as a forensic nurse. And then do the forensic examination after the consent. You know what is consent? There are implied consent limited with the physical examination, and written consent, oral consent. So these consent, she has to explain detailedly what are we admitted for the hospital, what is the scope of examination, what we are diagnosing, why we are doing this exam for her. Either you have to tell them, accused or the victim, you have to responsibility to tell the individual. It is a fundamental right of the accused and the victim. Then forensic evidence collection and the documentation of the preservation. As we told, if she failed to do that, she will be imprisonment under the IPC section 201. Last video we have seen. The labeling also very important. The label should possess all the reference number and everything is an important, because it's a legal document, legal evidence. This is the evidence will be give direction for the judges to enact the justice to the world. So according to this evidence, it will give a direction to the judges to give the correct judgment, to better implementation of the justice to the world. So it's in the hand of the nurse. She do any malpractice or anything, it is really punishable. Then psychological treatment, there's another one, counseling and legal education she can give, and lobbying with the multidisciplinary team members, lawyers, police, social workers. She should be act as a lobbyist. Okay, do the holistic approach. Sometimes she has to allow the spiritual leaders to meet with the victim or the accused according to their legal protocols. She has to follow. She should not take autonomically decision with a team member without violating the rules and laws, and also respect the custom and culture of the particular community. And also she should must contribute much in the research and the continuous quality improvement for the further development of the forensic nursing protocols. So case studies, case reports, she has to write and she has to publish it. So she has to disseminate the research knowledge. It will motivate the upcoming nurses to take up the new role of the forensic nursing. So forensic nursing, since he is knowing about the law and other thing, the nurse can enter into the politics very easily. Once what will happen when you enter into the politics, you can influence the lawmakers, you can influence and do the many things in the society and serve the people of the nation. Correct? So today's class, we have seen clearly about what are the qualities of forensic nurse, what is the scope of nursing practice for the forensic nursing, and who are all the nursing team members, forensic team members, and possessing all these qualities, what are all the roles and responsibilities our forensic nursing or nurses are playing. Thank you.